The OPTIPARK trial was an open-label phase 4 study in patients with Parkinson's disease and response fluctuations who were for the first time placed on Opicapone. And it was performed in Germany and in the UK. The duration was 3 months in Germany and 6 months in the UK. There were almost close to 500 patients participating in this trial. And the primary outcome was the global clinical impression of change experienced by the patients. So after 3 months in the sample, it was more than 70% of patients who reported that they had experienced an improvement of their condition with the addition of Opicapone. And very remarkably, it was more than 40% of patients who reported that their condition had much or very much improved, which is a very potent clinical effect in this outcome parameter. And this was also mirrored by the physician's impression of clinical change. Here again, more than 70% reported their patients to have improved after being placed on Opicapone. There were some secondary measures, including UPDRS Part 2 and 3, which reflect activities of daily living and motor impairment. And there were also scales measuring non-motor symptoms and quality of life, namely the non-motor symptom scale and the Parkinson's disease questionnaire 8, a short version of the quality of life questionnaire PDQ 36. And in all these secondary measures, there were also improvements in favor of the treatment with Opicapone. In the sphere of tolerability, it was again dyskinesia, which was more often reported as a treatment emergent adverse effect, which is quite natural that due to the mechanism of CMT inhibitors, that you improve the bioavailability of levodopa, you will of course have also a proportion of patients who will then experience dyskinesias, which can and should be managed by reduction of levodopa in the, as also already discussed with respect to the sub-analysis of the BPARK-2 study. This was also done in the OPTIPARK study, and there were only very few patients who stopped their treatment due to the occurrence of dyskinesias. So to summarize, the OPTIPARK trial replicates the findings of the double-blind studies that the CMT inhibitor Opicapone is highly efficient to treat response fluctuations, and that it is very well tolerated, and that hyperkinesias can be managed by reduction of the levodopa dosage.